So far, they have found that the 57 suspected cases, as of today, Wednesday, 11th March, have proved negative. However, it is imperative that we step up our preparedness to ensure that beyond these initial satisfactory measures, we adopt a whole-of-Ghana approach in adequately preparing for a possible hit within our borders. In order to do so, at my prompting, the Minister for Finance has made available the CD equivalent of 100 million United States dollars to enhance our coronavirus preparedness and response plan. That is to fund the expansion of infrastructure, purchase of materials and equipment, and public education. I have, as of yesterday, ordered the suspension of all international travels by public officials, except for critical assignments, which will have to be authorized by the Chief of Staff at the Office of the President. All public officials are to remain within the jurisdiction until further notice. Video conferencing facilities and other technological tools are to be utilized whenever possible for international engagements. I've also instructed further enhancements of the protocols for inbound traffic from already affected countries. Fellow Ghanaians, all of us should, as much as possible, desist from all foreign travels, except the most critical ones, until there's a grip on the virus.
That's President Akufo-Addo there earlier this year after Ghana recorded a few cases of the virus. Well, it's the biggest health news it has been for 2020. It dominated headlines across the globe. According to Johns Hopkins, over 1,800,000 lives have been lost to coronavirus and over 82 million cases have been reported globally. That's a pandemic that has completely changed the world, forcing governments to shut down places of worship, schools, recreational centers, etc., and locking us all up in our rooms at a point. The coronavirus took a toll on all of us, especially our gallant frontline health workers, so who we will be hearing from shortly. Joining me via Zoom now is Dr. Justice Yangson. He's the General Secretary of the Ghana Medical Association. I also have Cecilia Seno. He's a human rights and gender advocate and a public health specialist. Executive Director for Hope for Future Generation. Also joining us on phone, Dr. Patrick Abuaje, Director General of the Ghana Health Service, and Eric Kakari-Boateng, Head of Laboratory Services at the FDA. So it's a full house. Lady and gentlemen, you're welcome to the show. Thank you for your time.
Thank you very much.
Dr. Yangson, let me start with you. It's been one hell of a 2020, hasn't it?
Exactly so, but thank God we've managed to raise the storm. And I think as a country, in terms of managing, we've done quite well. The world has acknowledged our efforts.
If you were to review 2020, you know, in a few minutes, I know the coronavirus dominated. You can talk about coronavirus if you want to, but to what extent did we neglect other health concerns that require, you know, some serious attention?
Okay, let me put it this way. Yeah. Corona basically took all of us, you know, just at a point where we were not ready for it. Let me put it this way, as a world community.
Yeah.
But once it came to our shores, then we were compelled to basically try and revise and review the way we operate just to accommodate COVID-19. Now, in as much as we did not intentionally go out there to neglect the other health concerns aside of coronavirus or COVID-19, the pandemic itself brought up a situation where we were forced to scale down on some activities that routinely we were undertaking in the health facilities. For example, we had to suspend some surgeries, what have you, all because the focus was on COVID-19. COVID-19 patients were occupying some sensitive places within our health setup. For example, the ICUs. You need an ICU to, let's say, nurse or manage patients most times right after surgery. Here we were, most of them had to be downgraded to enable COVID patients take over. So some surgeries will have to be suspended. Our OPDs were usually crowded to start off with before COVID. But once COVID set in, we're compelled to scale down on OPD attendances just to ensure that physical distancing and all the bits are in there. Beyond that, there was also the higher risk in the health facilities. So ultimately, you could see that the other health problems, I would say, were sort of downgraded slightly, not because that was our wish, but it was just the circumstances. But by and large, we also managed and became a lot more innovative, tried to reach out to a lot more people via technology, video, conferencing, normal phone calls, what have you, to try and fit in. So telemedicine, for example, became one of the tools that we were using to manage patients remotely. These patients hitherto probably had some chronic problems. They will always come to the hospital for their drug reviews and what have you. So I think it was basically a balancing act to sum it, just to accommodate the impact of COVID on all of us.
A balancing act to accommodate the impact. I would love to end this conversation by asking what lessons we have learned to move on into 2021. But let me bring in Cecilia Seno. She's a public health advocate, Chief Executive Director for Hope for Future Generations. You, Madam Seno, I know that you work a lot in rural communities, focus on public health over there. To what extent would you say the year, how would you review the year in terms of health generally?
Yeah, thank you very much. Good afternoon, and good afternoon to your listeners. It has been a very difficult year, even though we started very well, as the previous speaker has just said. Coronavirus has changed a lot of things, especially other communities that we work in, especially among civil society organizations, among our beneficiaries, persons living with HIV, persons living with TB, and all other families who really have these challenges. The issue is that, yes, novel coronavirus has changed many things because it's a disease that many of us are not aware of. The virus has really disturb our normal plans and interventions as health advocates. For example, I will talk one about our health facilities. I know Ghana Health Service, for that matter, Ministry of Health, have really put a lot of strategies in place to address and respond to other diseases, but unfortunately, a number of diseases were not the focus during the year because coronavirus tend to be more emergency than others. For example, for HIV positives, during the lockdown, it was very difficult for persons living with HIV to access their ARVs, antiretroviral drugs, because the facilities are more particular about coronavirus than HIV, which we think that HIV is more chronic, is not emergency. Immunization and mothers were finding it difficult to go to facilities because it was difficult to assess. Focus has been basically to persons affected and infected with coronavirus. So that is what I would say. If you look at other diseases like malaria, TB, and the rest, it also affected our interventions as civil society organizations. Our health education interventions have gone down. It was difficult because You cannot travel to many of the communities that we work in, mobilizing communities, educating them, educating others on maternal health issues and all other basic things. So I think I would say that has been our challenge for 2020.
Very well. Let me bring in the Food and Drugs Authority. I have Eric Kakari-Boateng. He is the head of laboratory services at the Food and Drugs Authority. Mr. Kakari-Boateng, you've heard the GMA indicates that it was a balancing act, essentially. It wasn't like people deliberately, that as a country we deliberately overshadowed the other diseases. It was inevitable. But it's also given us some ideas when it comes to testing, our testing regimes, etc. You do speak to the testing regime and what the future looks like for the virus, especially on the new strain or the virus that we're getting to hear of.
Okay, yeah, as it was said, it's been a challenging year, but out of challenges bring innovation. Before this year started, I mean, we had about only 8. I'll talk about the equipment later, but we had about only 8 sanitizers on our register, and they were imported. Nobody knew we could manufacture sanitizers here, but now we have 1,000, and over 90% of them are being manufactured locally, and they all qualify. They all meet the international quality standards for hand sanitizers, that's with respect to the alcohol base.
Did you say we moved from, what, 8 to 1,000?
Yes.
Wow.
Yes, 8 to more than 1,000, yeah.
Okay.
And then the jump was all due to local production, not importation.
Okay.
And we were the first, not like us at night, on record, Ghana is the first country to develop specifications for cloth marks, which was done in-house at the FDA together with the Standards Authority. So, yeah, that is it. And also, when it comes to the authority upgraded its capacity in terms to assess products used in the diagnosis of virus, meaning that's molecular biology and then molecular diagnostics. So then let's come to your question about, you asked a question about the new strain, yeah?
Yeah.
Yeah. For now, we don't think that, no, yes, the FDA is monitoring it carefully, yes, with all the PCR kits and then the antigen kits that we have approved for use in Ghana for the detection of the SARS-CoV-2 virus. We have 21, we have 18 PCR kits approved, and then 2 antigen kits approved. Yes, the one at the airport is at antigen, and we just approved one recently. Yes, there has been some mutation, but then if you know, the mutations that have occurred are only in the information available now, only with respect to the spike protein. The SARS-CoV-2 VU1 2020-12/01, which was detected in the UK, there are about 8 mutations. And they are all with respect to the spike protein, the protein that attaches to the epithelial cell for the virus to invade the respiratory tract and then cause infection. And the 8, I think, like, you know, protein is made up of amino acids. It's amino acids that make up protein. If you look at, there have been deletion of the amino acid 6970, deletion at position 44.
Okay, that's all very technical right now. If you can so break it down to the English that we can follow.
Okay, all right. So this, but then the devices that have been approved, especially with the antigen kits, that one, the target is the nucleoprotein. The kits, they are designed with antibodies to capture the virus, that's antigen, with the nucleoprotein section. So far, all the information available, there has not been any serious mutation, or there's not been any reported mutation with respect to the nucleoprotein. So for now, the detection of the virus, the antigen or the virus by these machines, the one at the airport and the one that was recently approved, wouldn't be any problem at all. If these variants get in, they will be detected. And of course, with the PCR, they target multiple genes. We have the ORF, the E gene, and the N gene. So far, the E gene and N gene, no reported mutations there. It's in the open reading frame that there are mutations. But of course, 3, you can detect 2. So that is not a challenge.
I'll come back to you, and let me bring in Dr. Yankson once again. Dr. Yankson, I am wondering, going into 2021, seeing that there is a new strain, at least across the world, in some parts of the world where they have seen major casualties, what is the Ghana Medical Association's expectations going forward?
Hello?
Hello. Hi, Dr. Youngson. Please go ahead.
Yeah, could you kindly repeat your question? I lost a bit of it.
Yeah, I'm looking at the health workers like you, what your expectations are going forward into 2021, considering the new strain that we're hearing about and what the FDA has just explained.
Okay. So let me just touch briefly on what Eric said.
Yeah.
You know, when he was trying to describe the changes, the mutation,
yeah.
you said he should bring it down to our everyday use. Yeah. Take it like, say you have a coconut, okay?
Mm-hmm.
The outer bit, the greenish bit,
yeah.
is where the changes have happened. Mm-hmm. The fruit inside, which is the nucleus, the changes haven't happened in there. So that's what he was trying to say, that it wouldn't affect so much our ability to test and get it right.
Okay.
I hope you get it. The focus is on the whitest part of the coconut fruit. The outer bit is where the changes have occurred. That is not so much of the problem, because the testing will be focusing on the inner bit, which is the whitest bit of, say, the fruit.
Okay.
So just to sum it up that way.
Yeah.
Now, to your question, if we look at ourselves as health professionals, throughout this pandemic, I must say we were really stretched, and our commitment levels were, our expectation is that, one, the general Ghanaian populace will adhere more strictly to the preventive protocols so that we limit the number of infections going forward. Two, based on all the lessons we have learned so far this year, we think that our ability and our expertise in terms of handling COVID-19 will be much, much, much better, even though at the onset, we have been judged as one of the best countries in terms of care for the patients. So we are expecting that 2021, our management skills, our protocols will all be an enhancement on what we have currently. In terms of prevention, the general population, we are expecting that they will adhere a lot more strictly to the preventive measures so that we reduce the number of cases. And then in terms of managing other non-COVID cases, based on the lessons we have learned and the technological innovations and investment that have been done, we'll be able to deal with a lot more of the cases that hitherto, probably because of lack of technology and the fear of the unknown about COVID-19 and all the bits, sometimes prevented people from getting access or the right access to care. But above all, the vaccine could be the game changer. And it is our expectation that with or without mutations that have occurred, the variants that we have in the system, the vaccines that have been produced the world over will help slow down the entire pandemic. And then hopefully we should be out of this hula balloon, maybe within the shortest possible time. That's our expectation.
Have you heard anything about the conspiracy theories about the vaccine? Because you mentioned the vaccine. We've heard a lot of them already.
Yeah, to be honest with you, we expected these conspiracy theories to happen. This is not the first time the world is going to use a vaccine. Vaccines have been with us for a very, very long time. And to date, the ones that we have used for decades, polio, what have you, we have seen the results. The results far outweighs all the negative comments and the conspiracy theory. But these people who are engaged in these theories will never stop engaging in same. The key thing is that we'll continue to educate people to understand the importance of vaccination. And when the benefits are there for everybody to know or to see, I'm quite sure that a lot more people will disregard these conspiracy theories. Issues like polio, for example, let's take a disease like polio. For so long a period, polio was a big problem for all of us. But if you look at our record in recent years, as a result of the vaccinations that we consistently did to more or less prevent people from getting polio, the number of polio cases in Ghana and even the South region and the world have dropped. So vaccinations have always been beneficial ultimately. except to say that these theories are there. We are very much aware. We will continue to educate the populace and also urge the populace not to focus so much on these conspiracy theories because they don't help ultimately.
Okay. I'll let you go because I understand you need to go. But then personally, how has the pandemic taken a toll on you and your colleague health workers, if you were to review it that way, on a very personal level?
Well, to be honest with you, first and foremost, I must say I'm thankful to God. I've not come down with COVID. I've tested, countless times. I was really in the thick of events when the pandemic got to our shores. I was a member of the Emergency Operation Committee at the highest level. I was part of the people who were doing all the advocacy, the social mobilization, what have you. I was part of the people who were trying to get some of our treatment centers in place because at the time we were not really using those facilities that existed for COVID management. I was always in touch with the case management people. Sometimes I had to see some patients along the line. Beyond that, I was also involved in the construction of the first Ghana Infectious Disease Center at Pabenya. It was a lot. I was all over the place. It took a big toll on me in terms of the pressure, in terms of your inability sometimes to be closer to your family. There were times that I was detached from my family just to make sure that I limit any potential risk that I may be carrying home as a result of my being part of the front line people who are all over the place. And that even within the clinics, the risk was always there. So it took all of us. But to be honest with you, I was never going to give up because I believed that, look, men and women will have to stand up and confront this head on.
All right.
The problem is that it cannot be resolved by one person. We need all hands on deck. Okay. And being a professional who was confronted with this, I told myself I was going to face it head on. And thanks be to God, we've all been good. We lost some members of our medical community. Some were our teachers, some were our mates, some were our juniors. It was a tough time. Some of the people were personal friends, and the impact was that much. But at the end of the day, we were all committed that, look, as health professionals, whether we were doctors, whether it was the nursing staff, the laboratory people, anybody who was involved, including the everyday, with all due respect, cleaners, orderlies, whatever, people were committed. Some got infected in the line of duty, and it was that bad. Some lost their lives. But after paying the ultimate price, I think that if you look at the global picture, our sacrifices have really put Ghana up there in terms of the countries that were able to manage this very well. And we are grateful and happy for those outcomes, except to say that we'll still urge the community to remember that COVID is real. It is still here with us. People keep testing positive on a daily basis. People keep getting admitted into the health facilities. We should not lose our guard at this point.
All right.
We need to ensure that, especially going into the days and weeks post these festivities, where a lot of gatherings are happening, we'll be able to go out there and test as many people as possible and make sure we address any potential risk out there early so that we don't have significant community spread. That is the only way we'll survive, because as a country, our best bet is the prevention, not the curative. We've been good at the curative, but our capacity, if we get to the levels of the UKs of this world and what have you, we can never handle that. And we pray to God we don't get that. But we need to back that with a physical bit, which is the preventive bits that the general population will have to adhere to.
That's true. Thank you so much, Dr. Yankson, and do convey our gratitude to your other colleagues. We really appreciate them. We don't take their efforts for granted.
We are also grateful, and let me also take this opportunity to thank all of you, the media, especially multimedia, for your yeoman's job in ensuring that you made sure everybody understood what COVID was all about. You made sure that all the preventive protocols were known by everybody. We are very grateful to you as well.
Hi.
Have a prosperous 2021.
You too. And I'm sure we'll be here to talk more about how we're handling the coronavirus on the other side of the year.
I'm sure.
Dr. Jansen. Right, you're welcome. Dr. Justice Jansen is General Secretary of the Ghana Medical Association. He's leaving the conversation now, but I still have Erica Karibuating, who is Head of Laboratory Services at the Food and Drugs Authority. Dr. Patrick Abaji, we're expecting to, have him on the phone as well. And Cecilia Seno, who is a public health advocate. Right, we do have the Ghana Health Service. So let me quickly go to Dr. Patrick Abuaje, and I'll come to you, Eric, so that we talk a bit more about what Dr. Justice Jansen indicated. But of course, the Director General of the Ghana Health Service is here with us. Dr. Abuaje, Happy New Year in advance.
Well, thank you. Many happy returns. Happy New Year to you.
Thank you. So let's take a look at let's take a little step back and review our interventions, our ability to handle coronavirus and other diseases in the year. What is your reflection?
Well, thank you very much. Well, we started the year with some cases of CSM, especially in Upper West region, which was led to a significant number of deaths, but eventually was curtailed. And then we had a COVID, and I believe that there were initial challenges, just like all other countries. But we found ourselves in a way that we felt that we were able to manage. Managed in quotes, because if you lose life and people are fallen ill, one cannot say. But by and large, I believe that our response was led by the president and the other technical team was appropriate in containing the disease, especially when you compare to how it had devastated other regions and our level of exposure and how we were able to keep the numbers down. I believe that not just the health sector, but also the people of Ghana participated in the response.
How did it personally affect you? How did this year personally impact you? Looking at your position, I'm sure it was a whole lot of stress.
Well, I would say I've managed crisis, but this was a bigger crisis. And every day there were new issues that had to be addressed, not just ways to address tomorrow, have to address it immediately. And so we had to spend a lot of time, day and night, working to ensure that we are responding to all the issues across the country, all districts and all communities, as and when the results came. And I had a good team that we worked, but just that was a bit tedious, a lot of work. I think for a couple of weeks, I don't think I had more than 4 or 5 weeks, 5 hours of sleep any day. So
that's very unhealthy. That's very unhealthy, as you, the health experts, tell us, isn't it?
Yes. But you see, when you are responding, you are also looking at other people's health, not just yours. So
okay,
it's a balance.
I want us to talk a little bit about the vaccine, but let me bring in the FDA. Mr. Kakari Boateng, I'm sure that you are still there. One thing that I wanted to ask is whether or not the FDA has a plan to deal with the conspiracy theories that has just started coming. I'll have Dr. Abuaje also speak to it, but what is the localized plan, if any, on the part of the FDA?
The conspiracy theory against the vaccine?
Oh, there are plenty going on around social media. I mean, people are saying that...
The only thing that I can tell you, and then the FDA would like to assure Ghanaians that every vaccine that is approved for use in this country would have met all the standards as quality, safety, and efficacy. And as you know, we have the wherewithal to do that. So we are going to ensure that every vaccine that is approved for Ghana is of the right quality, it is safe, and then efficacious. If it doesn't meet the bar, it would not be approved.
Okay.
That I can tell you for sure.
That said, let me bring in Dr. Abuaje. Dr. Abuaje, how soon are we to bringing in the virus? How close are we?
The first process to get a vaccine that the FDA will approve, and then we'll take it from there. And so I'm sure a lot of work is going on, and I know a lot of work is going on. And once the appropriate vaccines are registered, I believe that the system will put in place to quickly vaccinate people.
How will this vaccination look like? Okay, please go ahead.
So I think there's a lot of activities are taking place in terms of getting some through Gavi, and we are also looking at the other ones and all of them will have to be registered by the Gavi, with FDA. And once FDA registers them, then it's safe. And just to add that FDA is one of the best, probably the best in the sub-region. And we have faith in FDA that they will give us the right standard. Okay.
I'll come back to you, Dr. Boaji. Let me bring in Cecilia, and then I'll let Mr. Kekari Boateng go afterwards. But Cecilia, you work at the grassroots. You visit hospitals, etc. To what extent do you think they are open to a vaccination that is coronavirus related?
Yeah, thank you very much. Like any other vaccination, I think the awareness, the whole country is aware of COVID, and everybody is aware that there is vaccine in other countries. So I know people will be willing to take it, but we'll still need to do a lot of education because you already indicated that there's a lot of social media conspiracy theory all over. And you remember when Ebola came, how the trial went. We will need to really sensitize Ghanaians to understand and accept so that people don't come out with counter information to prevent people from taking it. So
because you deal with the people. Okay, so we have the Director General of the Ghana Health Service listening to you right now. You also have the FDA's representative listening to you. As a social worker who goes to the ground, what will be your suggestion? Will you advise them in terms of how to carry on this process, get people to understand the vaccination process and to buy in and be a part of it?
I would suggest that we do community mobilization. Social mobilization is very important to educate people to understand the benefit of the vaccine and how it will be given. If people accept it, I don't think it will be a big challenge. I only want us not to just go and start vaccinating people, but to let them know. That will be very important, to work together with communities, with civil society, religious bodies, everybody, so when the vaccination starts, we can roll it out successfully. Okay.
So, Mr. Kekari Boateng, I want to come to you. Is there anything from the FDA side that you'd like to add to this conversation so we can wrap it up on that? And I will stick with Dr. Patrick Boaji.
The only thing that we say, we'll continue to assure Ghanaians that every health product that we put on the market to fight COVID will be of the right quality and will not compromise the public health, the public safety of the Ghanaian people. That's what I have to say. People should not forget that the disease is there. They shouldn't say that the disease is gone. They should continue keeping the protocol. Because we've been working like hell Sunday to Sunday for the past, that was from May to July, and now it's coming back again. So, it's better we prevent us. As we say, prevention is better than cure.
I've been taking personal stories. Do share your personal side of the story with us.
My personal story from the 27th of March to the second week in July, we worked 7 days, Sunday to Sunday, testing sanitizers, face masks and shields. So, a whole lot of things, reviewing applications for this PCR. It's been a hell.
How have you managed your social life, you and your other colleagues? How have you been able to manage your social life and stay sane?
It was a pandemic, and we're in the crisis of a pandemic, and somebody had to do the work. So it really had a toll, especially the Easter. For the first time, for Good Friday, Easter Saturday, Sunday, Easter Monday, we worked through for morning to evening. We didn't even realize it was Easter, but that's service to the nation. So.
All right. Mr. Kekari Boateng, thank you very much. You and Cecilia Senom, who's a public health advocate, thank you so much. I want to just stick to remain with Dr. Patrick Boaji, who's the Director General of the Ghana Health Service. Doc, let's talk a bit more about the new strain. What do we know about it?
Well, thank you very much. We know that there's a new strain, which, according to studies, is a bit more efficient in terms of transmission from one person to another. And what we don't know, what has not been proven, and what has caused a more severe disease than the previous one, so far no evidence has come that it caused more severe disease. We in Ghana, we have not identified them here. We're doing some genomic studies, as for example said, see how whether we do. I think we've done 2 already, and there's a process of going through another one to see whether it is here. But that's what we do. What we are doing is that because of our double-tier testing system at the airport, coming negative before you fly and test you and isolate you on arrival, we believe that is if people who go home on isolation adhere to the protocols, we should be protected from bringing in that strain into the country.
Is there any way we are planning to deal with it should it come? Because sometimes, I mean, when coronavirus started, it was more a matter of when and not if. So if it does happen, what is our plan to deal with it?
Well, our plan is the same virus. So the plan will be the same: test, isolate, and treat. The treaty, that's what we're going to continue doing. What we are currently enforcing is to ensure that we prevent the importation, because it's not here, it has to be imported. And so we have scaling up our effort and ensuring that those who are tested at the airport are not allowed, who are test positive, are not allowed to mingle with the community until it's okay. So those are the protocols that we are introducing to ensure that we don't bring it in. And then we'll continue managing. So the most important thing is that if you abide by the protocol as we continue to preach, and I have it and I can't give it to you, the virus does not transmit. And so those are the areas that we need to continue dealing with. There's no treatment for the new strain. There's no treatment for the old strain or the more common strain. And so prevention is still the most important approaching, and also reducing importation.
Okay. I mean, I won't overload you with all of that. I'm sure with time as we go along, we'll be able to unpack it gradually. But let's talk briefly before you go about non-COVID cases. We have learned, we've learned the lessons, I believe. What, upon hindsight, would you say we would do based on what we learned from coronavirus and how we dealt with non-coronavirus cases? I
didn't get your last question properly. I took at the beginning.
Okay, so I'm asking whether or not we have learned anything based on how we manage non-COVID cases and what we would do differently based on that knowledge we have acquired this year.
Well, I think one of the most important things is working together, not just in one sector, but all sectors coming together to respond to such pandemics or any such occasion. And I believe that bringing all sectors together and playing their roles appropriately is very, very important. Mobilizing the people is important, and most especially the media to be on your side and also provide appropriate information is something that we thought has been quite good. When we started with a lot of media information and misinformation, it was something that was good. And so through being proactive and providing the media with the appropriate information early enough, we believe has been very, very useful in the way we should deal with it. So whether it's COVID or any non-COVID issues that come up, I think those are very important lessons that we believe that we must.
Right. I was actually talking about how at the various health centers, how the Ghana Health Service will, I mean, what measures we are putting in place to make sure that we don't allow coronavirus, as it were, and as it has done, to overshadow the other non-COVID-19 cases, so that people get, so that people get equal access. Yeah.
One of the things that people have not looked at is the fact that despite all that, we managed to keep services afloat. We lost some grounds in the second quarter, but we caught up because as soon as the pandemic started, we asked my Deputy Director General to take control of the other disease, have a more closer oversight over that. Of course, we're all working on that. Secondly, we developed strategies, essential services packages on how to work. How, if people cannot gather, how do we reach them with public health information? How do we vaccinate children? How do we get pregnant women to come for antenatal care? All those guidelines were done and train all health workers. And as I speak now, the number of, let's say, antenatal care services have caught up. We didn't have any deficit in terms of care. Immunization dropped in the second quarter, but we've been able to catch up. And so we created essential services and then package, and we work with the regions. Every region, we identified a team for COVID, so that these are the 7 people who are responsible for COVID. The rest of you do your work. Okay. And that was done early, and that's how we were able to manage both the meningitis and other things. And if you, at the end of the year, as we present our report, we realized that we were able to really catch up on our coverage.
Okay, so hopefully we'll make it better in 2021. Like I said, I won't overload you
so there's a
with
lot
all of that.
From that.
Yeah, I won't overload you with all of that right now. We're going, to pray into the next year. So if there's anything else you'd like to share with our viewers, please go ahead. If not, we'll call it today.
Just to thank the media for their work. They kept us on our toes, sometimes for good or for bad, but at least it made us better. It made us do our work well. And we'll say that tonight is 31st night. It's a large opportunity for gathering. Let's do it properly so that we don't start the year with an explosion of cases, especially in Accra. And so churches and all those people who will be gathering around for whatever function or the other must respect the protocols, wear their masks, so that we can have a better 2021. Thank you very much.
Doc, thank you so much for your time, and we all wish ourselves a better 2021. Director General of the Ghana Health Service, Dr. Patrick Kuma Abwaje there. Well, let me leave you with this message from one of the doctors at the front lines that we spoke to yesterday. She talks about waking up from dreams of people who have died on her hands, asking her to save them. Listen.
Like a whole different environment altogether. You have to change everything, your clothes, your shoes, you put them on one side. And there was a lot of fear because we all didn't know. There was so much uncertainty. Today, and WHO says this, tomorrow says that. So you go to work, and it's to get, for our ICU, we had a charting room which had cameras, the monitors, so there are cameras on the patients with the monitors all there. But we have to go inside. Now going inside, you have to don your PPE. And I remember the first time I donned, it was so scary because it's like, okay, what if there's a break here and the person coughs and it goes into your nose or something? Like, it was so scary. But the thing I loved about this whole thing was that I managed to get a family out of it because we all learned to help each other. Okay. As in your colleagues became a family. So like there's nothing like we're your doctor, Jima, this is nurse's job. Like we are all doing the work, and it was for our ICU. Our ICU was a national COVID ICU. Okay. So we had that and that east, and so we saw almost all the critical care.
Did you see some people die?
Oh yes, a lot of them actually. Yes.
A lot of them.
Yes.
What does that do to you? Does it make you numb, or does it, make you just an emotional wreck until the next job is up?
Okay, so this is a very important question, and it's a question that I think a lot of health workers should be. As we keep asking each other at UGMC, and I really appreciate that. We ask, "Are you okay?" Because we were not okay.
You were not okay.
We've seen so many people die.
The national health insurance.
We've seen so many people die over our work. That's fine, but this was different. I mean, I worked in an ICU at Kolebu before I came to UGMC. Okay. So I had worked pre-COVID ICU, during COVID, and I've worked post-COVID in an ICU. It's different.
How different? Can you explain that?
It was, well, we had a lot of patients dying, ICU patients die occasionally, but it was back to back to back, and it was scary. And some of the patients knew they were going to die. There was one patient, I still sleep sometimes, and I wake up in the middle of the night and I see him as telling me, "Doc, I'm dying. What are you doing for me?"
Oh, that's sad. It's really sad.
It was the work itself got better because we got so much stronger together, but the emotional impact was. Yeah. And I would go home, and I remember I told my mom, because of confidentiality, I can't tell my mom there was this person or that person. Yeah. I'm like, Mama, today I can't. Sometimes I'll get home and I get to the gate, my mom will come and carry me. It's just so sad because it's all over.
Did you know that the number of COVID-19 cases in Ghana is going up gradually? This is largely because of the relaxation in the COVID-19 preventive protocols. The Ghana Medical Association is calling on all Ghanaians to observe the necessary preventive measures. Let's wear our face masks when we have to do that. Let's observe the necessary social and physical distances. And above all, let's observe the necessary hand hygiene. Be responsible and keep safe. Thank you.
320 deaths so far due to COVID-19. 48,055 confirmed cases at present. Over 500 active cases confirmed. Many more have not reported for diagnosis, and they live among us, in our homes, our churches, our restaurants, our offices. Would you help prevent this second wave, as many countries in Europe are experiencing second waves? Let's take to the COVID-19 prevention protocols. Observe strict hand hygiene, wear your face mask, observe social distancing.
Keep your distance. Physical distance is still a must if we must avoid a second wave of COVID-19. Think twice before you join a crowd. Is there enough space for adequate social distancing? Before you speak to anyone, take 3 steps back. They can still hear you. Let's all come together to avoid a second wave of COVID-19.
But I've been infected already. Can I get infected again? If I get infected, would I infect others? Wow, there's a lot we are learning about reinfections. But yes, data suggests that reinfections are possible. Therefore, to err on the side of caution, let's continue to wear our mask, especially in public places. Wash your hands frequently with soap and water, avoid crowded areas, and ensure social or physical distancing. Let's help prevent a second wave.
We have seen the impact of COVID-19 on various sectors of our lives. The hard decisions on restriction of movements. It is difficult to predict the outcome of a second wave. Let's all come together, wear our face masks, observe the protocols, hand hygiene, and social distancing. Let's prevent a second wave.